alcohol industry has made recommendations to government through negotiating forum Nedlac to deal with a possible third wave of COVID-19 cases over the Easter holidays. One of these proposals includes reinstating the 11 p.m. to 4 a.m. curfew. Now, for more on this, I'm joined by Mr. Sibani Mngadi, the chairperson of the South African Liquor Brand Owners Association. A very good afternoon to you, Mr. Mngadi. I see, as the industry, being very proactive in this particular instance. You have undergone 3 liquor bans over a period of 12 months. How would a 4th one affect the industry?
Well, it will be devastating for this industry. We have evaluated the impact of the 3 bans that you have mentioned. It's a significant loss on our side. We are talking about 38 billion rands in sales revenue that have been lost. On the government side, government has already lost around about 9 billion in excise taxes that these products contribute to the fiscus. And overall, we believe that there is a risk to at least 200,000 of the million jobs that the overall value chain of the industry supports. So in that context, even businesses that have been trying to recover, if we were to have another ban, it will mean a collapse and even deterioration of those losses.
Now, through Nedlac, you've made some recommendations to government as to how you believe this particular Easter season can fare. Talk us through some of those recommendations as well as the motivations behind them.
Yeah, the thinking is for us to be able to minimize the impact of the 3rd wave, we need to deal with infections that are happening now. And we do believe that if we were to contain as much as possible the large gatherings, we should be able to minimize those infections. So what we are saying then is the restrictions in terms of size of gatherings that were applicable at level 3, they can be applied now for that limited period to be able to minimize the number of people who gather for whatever reason, whether it's various cultural reasons as well as those who gather for drinking occasion. So if we get, say, to the maximum of 100, then we can be able to contain the infections. And then the second part, of course, is around whether is there cases of trauma that put pressure on the hospitals that need to cater for people already infected with or having conditions relating to COVID-19. We do believe that moving the curfew a bit forward, it does make a significant impact in reducing the cases of injuries in our country, whether it's interpersonal violence or road traffic accidents. And if we apply it that way, and in addition, we will be working with the Department of Transport, particularly focusing on road safety during this Easter season, we should be able to minimize that impact across the health system and have sufficient capacity to deal with the cases that might rise in the near future.
What has been found, Mr. Mngadi, is, as you mentioned earlier on, that the consumption of alcohol tends to put a very intense pressure on the hospital system. People consume too much alcohol and they end up clogging the wards and the emergency units. How then is the alcohol industry going to be able to, I guess, effect behavioral change? Because ultimately that seems to be the crux of the problem. South Africans just simply drinking too much.
Yes, firstly to address the matter, I think in all the 3 bans of alcohol, we have also had a curfew being extended during that period. So our view is that we need to identify what is the main contributor in the reduction of trauma cases during that period. We do believe that the curfew, particularly during New Year's Eve and various other times that we have had an extended and fully enforced curfew, it has played a significant impact in reducing the number of trauma cases just by people not interacting and therefore leading to a reduced number of interpersonal violence and other things. Certainly, we agree fully that this is a behavioral issue. If we are dealing with a behavioral issue, then it can be a short-term intervention like the bans have been implemented. We believe that we need to work together with government and civil society to identify the key drivers of irresponsible use of alcohol and have targeted interventions that deal with those specific problems. In area of drinking and driving, as I said, we do believe that the issue is around whether people believe that they have a chance of being caught, and if they are being caught, then is there a chance that there will be successful prosecution. To deal with that, we have offered to work with RTMC to provide them with alcohol evidence center. This is technology that allows them to to get evidence that is admissible in court and can potentially lead to a prosecution. And if we are successful in that, then we can probably drive behavioral change. There are other interventions during this period of Easter. Most of the companies working in this sector will be offering vouchers for e-hailing to allow people to travel safely between their homes and their places of consumption. And certainly what has been unfortunate is the banning also of what we call the off-consumption, the pocket stores where people buy and go and consume at home. We honestly do not believe that should be closed at all, because it doesn't necessarily pose any risk on infection. The risk is almost as equal as going to the grocery shop, and home consumption does not necessarily contribute significantly to possibility of interpersonal violence or trauma or other factors of trauma that may end up in hospital.
What then are you proposing? Are you proposing carte blanche access to alcohol for all South Africans every single day of the week, barring the 11 to 4 a.m. curfew?
Yes, what will automatically happen if we agree on a curfew, then it means the places where people purchase and have a drinking occasion on site, those places will then have to adapt to the curfew. They will probably have to close at 10 p.m. And that on its own then changes the drinking environment. Yes, of course, I think we do believe that the consumption for purchase for home consumption is really, the risk is minimal in terms of possibility of infection in the shopping occasion, as well as the drinking occasion at home is what probably we are promoting, that people sit in the security of their home and enjoy their beverages responsibly and avoid traveling and driving cars and that activity that may expose them to either the injuries or as well as the possibility of infection.
As we await announcement from the President as to a way forward, how will you react as the industry should there be tighter restrictions put to the alcohol sale and consumption during the Easter period?
We do believe that government needs to, I think what we have been hearing, particularly from the Minister of Health, is that all factors will need to be taken into consideration. We have an economy that has contracted something like 7 to 8%. We have unemployment that is increasing. We have low levels of consumer confidence. So all of those factors will need to be taken into consideration. This industry alone contributes 173 billion in terms of GDP. We have lost about 57 billion of that as a result of the past 3 bans. And to add to that, under the current circumstances, we do believe that government will not be conscious of the existing conditions where people are losing jobs every day, people are desperate for income and livelihoods, and there is a need therefore to balance the two and make sure that at least we save lives in terms of reducing infections and caring for those who are infected, as well as balance the businesses that need to keep running to provide employment and sustenance for other people employed in the sector.
Mr. Mngadi, thank you so much for your time this afternoon. That's Mr. Sibani Mngadi. He's the chairperson of the South African Liquor Brand Owners Association on their expectations as the industry ahead of the announcement as to the lockdown plans as the country approaches the Easter weekend.